show. Don't miss this stuff.
Ocala's information station, 1370 WOCA.
Ocala.
Diamonds in the sunset, now your time has come. A pretty yellow bird fly away.
All right, 5 minutes after 11 o'clock. Thank you for tuning in. Beautiful looking Thursday morning. And I don't know, maybe you can't tell anymore, but even this morning, I think you could probably tell in my voice that I had a little bit of a cold. Right? Big baby, right? Because I had a little bit of a cold, right?
No, you're human.
And I'm human. Yes, thank you. Thank you. Robin always backs me up. Mine was nothing. Robin, you had the flu, right?
Yes, I did.
You had the flu. Why does everything sound echoey all of a sudden?
I don't know. It's
just my headset over here. All right, yeah, and you went through this. I think Joe went through the flu thing. There was some troubling stories in the news of the flu actually killing a few people, and people you wouldn't expect, people in their 30s, right?
Right.
So we want to talk about the flu a little bit, and we have a lineup of some people who know about it. Dr. Richard Petrik is in the studio. He's the medical director of emergency services at Ocala Health System. Heather Howard is a registered nurse, the clinical coordinator of emergency services at Ocala Regional Medical Center, and Travis Kitchen is here, the clinical coordinator, there you are, of emergency services at West Marion Community Hospital. And, of course, Brittany is here. And over there, I never know how to say your name. Martheller? That's good enough? See, I hate when people say that's good enough. That's why everything was echoing, because her microphone was off. Now try it. Now try it, Brittany. Where are you? Say something.
There she is.
There you are. Oh, there you are. Okay.
Yeah.
Okay. Well, thank you all for coming in. Yeah, the cold is nothing. The flu was big. I was worried about Robin when she had that flu. So, well, good morning to all of you. Thank you for coming in.
Good morning. Good morning. Thanks for having us.
Where is everybody's microphone right now? I'll have to find you all.
There you go.
So let's start with vaccinations. Okay. Are you guaranteed not to get the flu if you get the vaccination?
No. So the flu can change very quickly. So each year, the flu vaccination is based on the year's previous subtypes of the flu.
Oh, really?
And they try to take their best guess at what the next year's subtypes are going to be.
Who are they?
The CDC and epidemiologists and people that are making the vaccinations. So they try to take their best guess at what the flu is going to look like the following year, and they put that into the vaccine. Some years it works, and they hit the right combination.
Really?
And some years it doesn't.
And what do they use to educate? Like, how do they make an educated guess? What do they have at their disposal?
The previous year's
wow.
Flu.
And so it
types.
changes that much. It's like roaches that you spray them with Raid and they don't die.
Well, there's 3 types of flu, and they can combine their genes. And in 2009 we had a big outbreak called the swine flu, and that was H1N1. That's the current flu.
What does that actually
strain.
stand for? What is that? We see that all the time.
It's the neuroamidase and like a hemolytic.
Okay, sounds
component.
Very.
It's just 2 genes.
Okay.
How they combine the 2 things is how they come up with the vaccine.
Well, the way Walgreens has it on their marquee, the one looks like an eye.
Yes.
I thought for a while it was the Heine flu. I didn't know what it was.
Yeah.
Yes.
I said, we got the Heine flu now?
The Heine flu. Yeah. That's what it kind of feels like.
Yeah. Yeah, I bet it does.
One of the good things that Ocala Health has done, they've sent out a really nice postcard to a lot of people with the flu symptoms on one side and then visual diagrams on the other side. So it's very comprehensive about exactly what the flu is and how to treat it.
Yeah, and that'll help educate the public because the influenza-like illness, ILI, is sort of a very broad term. Mm-hmm. You can have a fever, sore throat, cough, and the CDC sort of describes it as that. And you can have that with almost any cold or cough. However, the flu kind of tends to come on pretty pretty rapidly, and it feels like you were kind of run over by a truck.
And that's probably what you felt like, right, Robin?
Oh yeah, I didn't want to do anything. I couldn't get up off the floor.
Well, she was just gone. So did you have emergency room visits from people with the flu, and were they surprised that it was the flu?
Surprisingly, we've had a lot of emergency visits with people who have flu-like symptoms, but we haven't seen as many as we thought we would. A lot of people are kind of going undiagnosed. They're kind of trying to tough it out on their own, and it's taking them longer periods of time to get better. I was at baseball practice. I have a 10-year-old that plays baseball, and one of the parents came up to me and was like, yes, this person, I think he has a flu, but we don't know. We can't get into his pediatrician. But he went to class, and out of the 22 kids, 12 of them were sick. The flu-like symptoms. And so a lot of people can't get into their pediatrician. They can't be seen, and so they go a longer period of time, and so they're out of class for a longer period of time. We're trying to set up a way that's, come see us in the emergency department. We'll get you on your way to health a little quicker, a little faster.
Okay. And can you? I mean, if you have a virus, do you have to let it take its course, or?
To certain points, but a lot of times with the flu, with the body aches, with the fever, you want to let the fever run by itself for a point of time, but there's a point of time that it can be dangerous if it gets too high.
Okay, now with that said, let me ask you this. We had this discussion yesterday, I guess it was. Now, we're just radio geeks, so we're not trying to pretend we know anything. But we have, every now and then we have, like, trivia.
That's right.
Okay, that's what radio geeks do. And so one of the things was about the old saying about feed the cold, starve a fever. Okay, so we read this whole thing about whether it was true or not. We got it from Reader's Digest, just to give you the credit where it was due. But it said sometimes it's better to let the fever be a fever. Even aspirin is sometimes bad.
It is in the case of a healthy individual. With a healthy individual, that's the truth, that sometimes you kind of starve a fever and let it kind of run its course. But a lot of our population here in Ocala is not a healthy population. They have other health risk factors that kind of exacerbate the situation. For example, I had a 9-year-old niece who had a seizure disorder. Every time she would get triggers that she would have a seizure, and she ended up getting the flu, and her fever went above the threshold of a seizure. She ended up having a seizure and dying. And so she had a risk factor that was exacerbated by the flu. That's why elderly population, I believe over 49% of Ocala is older than 55. We want to get
Imagine that, Robin?
Yeah, I think you might fall into that category. You never know. I, for one, don't. But it is true. Healthier individuals.
You know how you know you're old? When you work out the window by the mall.
Exactly. Right. I feel old right now looking out the window of the mall. You never know.
Heather, when people come into the emergency room.
She doesn't want to be asked any questions. She's having a good time, though, it looks like. Yeah.
But, people get, parents especially, they get all emotional and everything because you want to help your children. So when they come into the emergency room, you have to deal not only with the person that is having the symptoms to try to get them better, but also the emotional outbursts, I guess, of the parents themselves. How do you keep the parents calm while trying to treat the child?
Psychological kind of a question.
Well, there's an adage in medicine also. When you're dealing with pediatrics, sometimes you have to treat the parents.
Right. Oh, okay.
Oh, okay. Okay. That would make sense, yeah.
Yeah, because, I think there is a huge emotional component. Heather's very good with that, though. She's calmed down a lot of parents, calmed down a lot of patients with information and with her calming demeanor.
Female aspect.
Yeah, see? There you go.
What was that?
The female aspect.
Yes, I think so. How come I don't hear Brent? Is that Brent?
So when people come into you after trying to self-diagnose, doctor, have they done more damage than if they would have come in the first place? To themselves?
Actually, I think with the flu, there are the at-risk age brackets. The very young, the very old, and especially the pregnant. And some people fear coming in too early because they don't want to seem like they're
whiny or anything like that.
But I think it's important, especially with the flu, because we do have a treatment, Tamiflu, and Tamiflu is pretty effective against the flu. And if you get it within 48 hours, it's much more effective than if you get it after 48 hours. So if you start taking Tamiflu within 48 hours of symptom onset.
Oh, really?
Yeah, then you can actually shorten the course of the illness and improve the symptoms.
What is that? What is Tamiflu?
Tamiflu is oseltamivir, and it's an antiviral. It's a neuraminidase inhibitor.
Okay.
So the H1N1 thing, that's where that comes in.
I didn't know there was such thing as an antiviral.
There is. Well, I mean, we have antivirals for HIV, and since this is another antiviral that sort of affects a different piece of the viral package.
And the fetus won't be harmed if you give that to the pregnant mom?
Actually, it's very safe. It's safe in pregnancy. It's safe for the mother. It's safe for the fetus, and that's been demonstrated. Just through time.
So if a mother is pregnant,
there's a higher morbidity and mortality associated with.
But does the fetus literally get a flu too?
No, the fetus won't get the flu because they're kind of protected.
Okay.
They have their own circulation, and which is part of the mother's circulation. But the mother, if she does poorly, i.e., she gets the full flu, and then she, has respiratory distress, and then she, has the respiratory complications that come with the flu, then obviously the fetus is affected. Okay. So getting people in within the first 48 hours is really the key, so that we can actually treat them.
I didn't know. Yeah. You should have gone.
I know. I didn't even think about it.
And that's one of the problems. That's why I think Ocala sent out those flyers, so it kind of lets people know if you're having these symptoms, come on in, because the sooner you get in, the sooner we can help you out.
Wow. We do have a phone call, and I'm still getting that feedback in my head. So yeah, if you put your headsets on. Heather?
This phone calls for Heather.
I don't think she said anything yet. All right, here we go. I can't hear Brittany, and Heather hasn't said anything.
She just chuckles.
Here we go. You ready? Here we go. Good morning. Thank you for calling. You're on the air.
Yes, good morning. Good morning, doctor. If you come down with a certain strain of the flu, can you contact and catch another strain of the flu at the same time or right afterwards?
I think you can have subsequent flu viruses. Typically, after you catch the first one, your immune system is so revved up and ready to do battle and fight that a second one is more difficult to catch. Sometimes, if you catch the flu, you have a viral infection, that weakens your immune system just a little bit, enough for something else to hit you right afterwards, like another viral infection or even a bacterial infection. And that's the worry. Like if you get the flu, it causes some respiratory symptoms, and then on top of that, you get a bacterial pneumonia. That's where these people are having difficulties.
Oh, wow. Oh, wow. Did you ever follow up? Are you there? Oh, he's gone. He's gone. The phone lines are open. Let me just mention this. If you have a question and you'd like to ask it, go ahead. The number is 622-WOCA, the WOCA Climate Control Source Hotline, 622-9622. Just to reintroduce our guests is Dr. Richard Petrik, Heather Howard, who's a registered nurse, and Travis Kitchen, also a registered nurse. And in the background over there, Brittany Marthala. Marthala. I'll never see it. That can't be good. That can't be right. Is it a hard T? Marthala? Marthaler. Marthaler. I know I must have asked you a million times.
How contagious is the flu? I mean, usually if one person in the family gets it, does it run its course with everyone?
Well, that's the trick, is to try to avoid that, because obviously if your child is sick, you don't want to be sick as well, and then loss of work, loss of school. These are the things sort of play into the whole disease. I think good hand wash. This is spread by respiratory droplet. Someone sneezes, it gets on something, and then you kind of either inhale the respiratory droplet or you touch it to one of your mucous membranes, your eyes, your nose, your mouth, and then that's how it's spread. So good hand washing techniques. The minute I get a cold, I load the house up with Purell and just start, Purelling, using hand sanitizers and washing my hands a lot, teaching my kids to wash their hands a lot. Don't sneeze into your hand, sneeze into your, into the crux of your elbow. That's what they're teaching kids in school now. When we were little, just cover your mouth.
Right.
Now they're teaching kids to cough and sneeze into their hand.
Right.
So I think you load up the house with Purell, wash your hands a whole bunch, and it shouldn't spread as much. I work around people with illnesses and the flu every day, and And you
don't get it often.
I'm not getting
knock on granite, right?
Good. Yeah.
Knock on granite. Yeah.
So let me ask you this: so would somebody with a very strong immune system, could that person get the flu and it just feel like a minor cold?
Yeah, probably. Mm-hmm.
So I could have the flu and not know it. I could have a little tiny. It feels like a cold, but I could really be dangerous for somebody else. In other words. Maybe I shouldn't tell you this, but I'll tell you. Yesterday, Rob and I do music, okay? So when we're not here, we play music usually for nursing homes. So yesterday we went to a nursing home. I have a little bit of a cold. Was I possibly endangering them if they have a more compromised immune system?
Probably not. I mean, unless you're coughing and sneezing actively and you're kind of spreading the flu virus or any of the cold viruses. I mean, that's why it's hard to differentiate between a cold and the flu. But the flu comes on very hard.
Is flu short for influenza?
Influenza.
No? Oh, it is. Mm-hmm. Okay.
Influenza.
That sounds worse, doesn't it?
Yeah. Influenza.
Yeah.
Yeah. It sounds very old school, right? The grip.
How effective is the flu shot? Because I've heard some people say that when they get the flu shot, they get ill.
The flu shot is probably the number one prevention to not getting the flu that we have. It is effective, and sometimes it does kind of lower your immune system a little bit that you can get other things, but it's usually not. They're not getting sick with the flu. They just get general body aches and so forth. It's just your body fighting the vaccination that you receive.
This goes back to that, Fetocol I call Fetocol Starvaflu.
Starvaflu.
And some people say that because with flu you sometimes vomit and have some GI illness along with it, gastrointestinal illness along with it. And so when you get the vaccination, you're revving up your body's immune system, and that can cause that little low-grade fever, that feeling of being sick. But it's not a live virus. So you feel like you're sick, but it's a briefer course, and you're just getting your immune system to sort of see the virus, what it may look like, and to react to it.
Misconception with the flu virus is whether or not it's a live virus.
Yeah. Mm-hmm. So you can't get the flu from the flu vaccination.
Oh.
Brittany, I think I figured it out. There should be a switch on that microphone. I think maybe the vets turned it off. That happens sometimes. No, up further toward the big, nasty-looking windscreen. Yeah. If just Robin will turn it off for you. Heather, you haven't said anything.
Yes.
Heather, where were you born?
In Orlando.
See, an easy question, right?
Yeah.
Simple question, simple answer.
And do you use that one? Okay, use that one. Yeah. Okay. All right. Thank you, Brittany, for doing that. So,
I just let all the boys do the talking.
I noticed that.
Yep.
I noticed that. But do you have your share of times where you have a patient coming in and they're maybe beside themselves and you calm them? That's wait a minute, it's only the flu. Like, in other words, we get the news that says people are dying from the flu, right? So do you have people overreacting maybe?
No, I don't think anybody overreacts. I think if you have a concern and you're not feeling well, then you should come to the emergency room and be seen and evaluated and treated.
Mm-hmm. Has the Healthcare Act, the changes in that, has that changed your work at all, or not yet?
You really changed topics there, huh?
Well, I didn't mean to, but I'm just curious because the emergency rooms aren't normally. Am I wrong about this? I wouldn't think that would be the normal place to go if you had the flu.
We have a lot of patients that come to the emergency room for various complaints.
It's hard because flu season is between October and about March. That's when the flu kind of breaks out in a certain reason, and that's why we call it the flu season. So there's an influx of people who are sick, and so a lot of times their primary care physician is overwhelmed or overcrowded, and there is nowhere else for them to go other than like the emergency department or some other kind of
nights, weekends,
different places, nights, weekends. They don't have access, and the flu doesn't care whether it's a weekend. It doesn't care whether it's night, and so it hits you. And so we're trying to provide a place that they can. So during this season we do see an increase of people that have the flu come into the emergency department.
When people come to see you, doctor, should they bring a list of their medications along also?
Yeah, absolutely.
That they're taking.
There are certain medications that you can have some interactions with that if you're taking them, and you also go on Tamiflu. But we can easily figure that out there's a cross-reactivity checker that we use.
And what about the herbal things people use? Does that need to be mentioned?
Some people say that there's been some literature that would support the use of zinc in colds, because it binds to the flu virus and the cold virus, and doesn't allow it to attach to the human cells and create the cold symptoms. So it's one of those things where you can take it or leave it. I take zinc when I get cold.
I always do too.
Yeah, I think zinc and echinacea are the two. Coldies.
Remember that stuff that they used to put up, well, you could buy it over the counter? It was like a Q-tip with...
Zicam.
Yes.
Yeah.
They don't sell it anymore, right?
I don't know.
They sell the pills, but they don't sell the
the pills?
Q-tip thing, yeah.
Yeah, maybe that was...
Because it was, what was the news? It was hurting our sense of smell or something.
Yeah.
Direct zinc in
your nose, yeah.
I didn't know that, but that's... I definitely, I usually reach for, vitamin C, zinc, echinacea, some of the other homeopathic things before when I get a common cold. If something hits me pretty hard, I think I have the flu, then I would go, see a physician and try to get some Tamiflu.
Do you treat people differently if they're diabetic or if they're bipolar and on some kind of emotional medication?
No,
diabetic or bipolar?
Well, that's kind of two different
diabetic, bipolar,
emotional and physical.
Schizoaffective.
No, I mean, I think anytime you have someone with another medical condition, you always want to be careful about the medications you give if they're on other medications. But in general, the flu doesn't really have any boundaries and would affect everyone, and you should treat pretty much all of them the same.
So I have some advice for the flu too. This is only if you do a radio show, though. Don't mention it on the air, because everybody will tell you what to do.
That's right. That's right.
All right, let's go back to the phone, and you'll need your headsets again. Play the Jeopardy music while you're putting them on. Good morning. You're on the air. Thank you for calling.
Yeah, I have another quick question, if you don't mind. Can you donate blood the same day flu shot?
Can you donate blood the same day you get a flu shot?
That isn't my specialty, but I would venture a guess and say yes, because the flu shot is intramuscular, and you probably haven't your body hasn't had enough time to sort of respond to it, and it wouldn't be harmful in the blood donation process.
No, really. Yeah, Rob and I give blood regularly. Thank you for the call. And the other day we were going to go, and Robin said, "Well, you got a cold. You better wait." For my sake, so that not that I'm going to pass it on to somebody, but that it might make me sick if I lose a pint, right?
Yeah, well, when you're weakened and you kind of feel ill, and with the flu or with a cold, you get a little dehydrated, and giving blood is probably at that point.
Do you ever have a patient come in and you say, why don't you go get some chicken soup, drink a lot of water, get a lot of sleep? You say, wait a minute, my mother could have told me that. You ever had that happen?
Sometimes in the emergency room, we're not necessarily treating the disease, we're treating the patient. And you sometimes have to just give people your best advice and give them some consoling advice, and sometimes that is, you don't need a medication, you just need to get some rest, drink lots of fluids, and I think a lot of times that's what people are really looking for. They're not, when people come to the emergency room, I have no illusions that they're looking for me to, save their life like the television show. Sometimes they just want me to say, you know what, you have a cold, these are the things.
Oh, that's what I would want you to tell me.
They just want reassurance. People want reassurance that what they have is not going to kill them. They're not going to die from that, and that.
But you know what? But again, going back to those news stories, there was a couple of news stories just in the past month or so. 30-year-old woman in Orlando, I think,
Yeah.
right? Died from the flu. So you see that and you go, wait a minute, is this a different kind of a flu, or was she a special person? Was she weakened somehow?
So we earlier in the show we got into the technical aspects of the flu, the H1, the N1, and how those can combine and genetically. When a new combination arises, like the swine flu did in 2009, the population hasn't seen that, so there's no immunity to that. So it hits people and hits the population floor very, very hard, and people can die from it. You know, these pandemics, the pandemics that occur, these huge influenza pandemics. I mean, in the United States, we have 10,000 to 25,000 deaths each year from the flu. Worldwide, that number's 100,000 to 250,000 deaths from the flu. So the flu can be deadly. That's not necessarily deadly for everyone, but it's something you have to think about. Right. And if you just happen to not have an immune defense against that, yes, you would be susceptible. You know.
How do you keep adults self-motivated to drink a lot of fluids? Because I know as a parent, when my children were ill, I was there all the time, getting them up, making them drink, doing all this stuff. But then when I'm not feeling on top of my game, all I want to do is sleep. So how do you stress to the adult that they have to, do that for themselves just like they do for other people?
I was going to let Heather take that one, but she's nodding. I think she has lost her voice, so we're going to bypass Heather. She says she giggles when she gets nervous, and so
you're on tape, so you'll be able to see
we don't want to just hear giggling all the time. A lot of times we just have to tell upon discharge how important fluids is, and with the flu, if it gets to a certain point that they're coming to the emergency department, the flu can cause nausea, vomiting, and just dehydration. It'll get to the point where they can't hold any fluids down, and so they need to come to the emergency department to get IV fluids, to get them rehydrated, to get them on medications that they won't be as nauseous. But with any infection, whether it's viral or bacterial, the best defense is to try to flush that out from your body. And so the more fluids you take, the better it will be for your body.
Yeah, good advice. Brittany, I have a question for you, and I think you brought this up, and forgive me if it wasn't you who said this. Is there a number, like a nurse's advice line or something in our community?
We do. We have a consultant nurse line. It's a free service for the community, and the number is 800-530-1188. And you can speak with a nurse when you call that line, being the name consultant nurse. Obviously, for something emergent, we want you to call 911 or get to the nearest emergency room.
Right.
But if you're just not sure, if you need to go see someone, you can certainly call that number, and they'll give you some advice, direct you to a physician.
That's a really great service, and you're actually speaking to a live person, right? You don't get a push,
right.
A series of push ones and all that.
Well, initially, yes, because we triage, where you need to go to.
Okay.
But then you click through and you go right into a nurse.
Okay, and what was the number again?
800-530-1188.
Sometimes we go to the stores. I know I've seen this recently where the cashiers or the other help will have those masks on them and they'll be doing their job. Is that a good idea for them to have the masks on and do the job, or should they just stay home?
I think in the hospital setting, the masks are usually, if you see a nurse or a physician with a mask on, that usually means they didn't want to get the vaccination, and it's just sort of a public health policy.
Oh, okay.
So to protect them and to protect the patients. People that want to wear masks, I mean, I think the most important thing, like I've said, is hand washing and using hand sanitizer. So if you do have the flu and you're covering your respiratory droplets when you sneeze and protecting, stopping them from coming out with a mask, that obviously adds another layer of protection, if you're dealing with many, many people.
I love that word, respiratory droplets.
Oh, yeah.
Other than snot.
Yeah, no. I'm going to use that from now on, too.
Yes. Yeah. I know. I don't like
Excuse me, got some respiratory drops. If I could just keep you one more time.
Please mind your respiratory droplets.
I want to hear your reaction to this. Let's say this. I'm going to create a little scenario here. Two guys talking. One guy says, I'm going to go get the flu vaccine because I don't want to get the flu. The other guy says, you know what? I want to get the flu because after I get it and I'm done with it, I'm going to be better protected than you will from the vaccine. Somebody respond to that argument, because I've heard that before. somebody says, I want to get it because then I'll be better off afterwards.
Another adage, an ounce of prevention is worth a pound of cure.
Adage. I know what you were going to say with the air.
I would way rather get the vaccine personally than actually get the flu.
But is there a truth to it? Is the person who gets the vaccine better protected than the person who went through the flu?
No, but I mean,
okay.
If you get the actual strain that's running around and you actually get the flu with that strain, then of course, you're protected. But you had to suffer for many days. If you get the influenza vaccination and you get partial protection, maybe you will have a less severe course, and maybe you will have a season without the flu, and that's probably what we're all looking for.
Well, we appreciate you sharing your expertise with us today, and I want to make sure everybody has a chance to give out information, contact information. Brittany, do you want to start? Mm-hmm. Is there a number you can give that? I mean, you gave the consultant nurse line, which is very good, very useful. I
would recommend to call the consultant nurse line. I don't know if you want to give the addresses to the emergency rooms at both hospitals.
The addresses, do I have them?
Mm-hmm. I can give them. I just didn't.
That'd be
Oh,
good.
yeah, you give them, yeah.
Perfect.
I was going to let you asking me.
Ocala Regional Medical Center's emergency room is at 1431 Southwest 1st Avenue. In Ocala, 34471. And West Marion's emergency room is at 4600 Southwest 46th Court, and that's Ocala, 34474.
Okay.
And the passion that all four of you really exude for the people is really the key to helping everybody get better, because you have to genuinely care, and you cannot fool anybody with genuine caring. So thank you for your passion.
Thank you.
Doctor,
thank you so much.
Dr. Richard Petrik, thank you. Heather Howard, thank you for being here today. Travis Kitchen, thank you. And Brittany Marthaler. I got it that time, right?
Yes.
Thank you for what you do for
us.
us. This has been recorded, by the way, and as you know, Brittany knows this. It'll be on Facebook and YouTube by about 2:00 today. So you can share it for the listeners. You can share it, and the information is excellent information. Plus, it was a little entertaining too, right? All right, we'll take a little break, and we'll be right back. Thank you all so much. Thank you.
Marion County is a ministry dedicated to improving lives by providing affordable and decent housing. Help them help others by visiting the Habitat for Humanity Ocala Restore at 926 Northwest 27th Avenue. To schedule a donation, give us a call at 401-0075 and we'll come pick it up. For more information, visit ocalarestore.org. Habitat for Humanity of Marion County. Building homes, building hope, building community.
Hi, Danny Werfel here. Get moving with Florida Credit Union's fast and easy loan approval process.